um, pale, or you can say whitish. Pale, due to vasospasm result in ischemia. The second one is bluish color. That bluish color, due to accumulation of venous blood and because of the vasospasm, no new blood is going to the disease. Accumulation of venous blood and no arterial supply because of vasospasm. Vasospasm is still there and no new blood is going to the digit, and there will be an accumulation of more venous blood, that is with carbon dioxide. So collection of carbon dioxide too much in the venous blood, so that's why it gets turned into bluish. And the next one is reddish, red color. The hand will be more reddish. Why? Red color because of vasodilation and vasospasm is taken off. Vasospasm is over, and by this time the distal vessels are dilated because of the ischemic changes. This is the nature. When there is ischemic, carbon dioxide goes up, there will be vasodilatations. When there is vasodilatations, the pressure drops and the blood will rush from higher pressure into the lower pressure, and you will see the lot of blood. Patient will feel warm in the finger and they will see, oh my God, it turned into red. Patient can show you, my look, so this is pale, no blood, and this is bluish. Oh my God, then followed by redness. So these three things are happening in a cyclic order in primary Raynaud's disease. This is mostly, it is due to emotion. Okay? And the secondary Raynaud's phenomenon is due to underlying pathology. Due to underlying pathology. And try to understand what could be this pathology. It is not emotional. It is the narrowing of the arterial supply narrowing of the arterial diameter. What can cause the narrowing of the arterial diameter? It could be atherosclerosis, it could be injury, it could be fibromuscular dysplasia, it could be tuberous sclerosis, it could be multiple sclerosis, it could be SLE, lupus, rheumatoid arthritis. It could be connective tissue disorder that causes thickening of the wall, that causes stiffness of the wall, followed by less blood supply to the digit. Okay, so now to rule out that problem, you can do the Doppler study or you can do the arteriography. Then you will see where is the pathology. Okay, so now in how are we going to differentiate each other? Okay, get a bucket of ice cold water, and if you submerge the hand with the ice cold water, you will see, if it is a primary, you will see patient will be afraid. Oh my God, no, it's going to cause too much harm. I'm going to feel too much pain. I don't want that. But push the hand, then you will see the hand turn into bloated, ischemic, because the vasospasm. And patient will suffer from ischemic pain. Okay, so now, due to the underlying pathology, what are the pathology I give you? So write down atherosclerosis, connective tissue disorder, tissue disorder, collagen disorder, fibromuscular dysplasia, then tuberous sclerosis, multiple sclerosis, then SLE, then simply lupus, okay, then rheumatoid disease, and this happens when the person has an injury to the upper extremity, vascular injury, and the repetitive functions, repetitive action of the muscles, vessels, bones, joints. Okay, so those are the couple of things that cause damage to the arterial. It causes thickening of the arterial, so diameter of the vessels will be narrowed down and you can differentiate it. Okay, so this is Raynaud's syndrome and Raynaud's primary Raynaud's, known as Raynaud's disease, and secondary Raynaud's phenomenon. Okay, so we need to know this, and they ask questions, couple of questions from the in the board exam. Okay, so that's the two things, and now I will discuss about the thoracic outlet syndrome, TOS. Thoracic outlet syndrome, we call it TOS. Thoracic outlet, what is thoracic outlet? Thoracic outlet is superiorly. The chest case and the neck. So this is an opening for the thorax. We call it thoracic outlet. The behind is vertebra and the ribs, and anterior is the vertebra, ribs are coming like this. It makes an opening. Okay, and anterior, this is the sternum, then ribs and the vertebra. So this is called thoracic outlet. Then what happened? That there is some sign symptoms. Thoracic outlet, are you okay? Are you doing okay? No, I am not. Why? There are some important structures is traveling over me, over the thoracic outlet, in order to go to the upper extremity, and they arise from the center and it goes towards the upper extremities. And as their origins, they have to go through some structures, and they have to go in between the two hard materials, and they might be in trouble during pregnancy, or take a deep breath, or like a military press, or Edson test. Then what are those structures? They got compressed and they give the symptom while the neck is moving like this. Neck is extended, just like extended and turn backward, and take a deep breath, and they found that radial pulse volume is getting decreased. Okay, sometimes the military approach, they go like this, chest forward, hand down, and shoulder up and down, shoulder back and up and down. They feel pain. Why? Because the some structures are getting compressed. What are those three structures? Three structures are getting compressed. During certain maneuver. Maneuvers, or because of anatomical defect, or because of repetitive functions of the extremities, especially the upper. Then what are those three structures? Number one, brachial plexus of nerve. Brachial plexus of nerves. So brachial plexus, that's the nerve. It comes from root 5, 6, 7, 8. Okay, so the root of the nerves that arise from that level and forms the major nerves that supply the upper extremity, like a radial nerve, ulnar nerve, then the median nerve. So those are the main nerves that comes from the root, from the neck on the posterior surface, and they comes through there's a gap in between. They come in between of scalene anterior and scalene medial muscles. This muscles has a tendinous part, and this tendinous part can be calcified and they will compress the nerves. Okay, and that nerve will come not alone, it will come with the subclavian artery and it will accompany the subclavian vein. So three structures: brachial plexus of nerves, then subclavian vein, and the subclavian artery. These are the three major structures. Those are in trouble. But this is the most common cause of the pain. That is the most common symptoms of thoracic outlet syndrome. The nerve compression. Nerve compression means you know what is nerve pain. Unbelievable. Radiating pain. Too much pain. You cannot move your hand. You cannot move your neck. So much pain. Okay? And subclavian vein. I am giving 2 check mark. Subclavian vein is next to nerves, next to neural pain. Subclavian vein, if it is compressed at this level, it could be compressed in between the collarbone and the first rib. It could be again compressed by the accessory rib, additional rib in the cervical region. When it is compressed, the vein, then venous return from the upper extremity will be back up. So that arm, forearm, hand, digit, all will be swollen, painful, heavy, edematous. Okay, congested, venous congestion, venous pressure will be higher. That is subclavian vein. And among these three, the less common is subclavian arterial compression. So usually not all threes are in trouble at the same time. No. Most of the time brachial plexus of nerves. Okay, and subclavian vein easily you can rule out by doing the Doppler or physical examination. You can rule out subclavian artery compression. Then you will see the ischemic changes in the extremity. Ischemic changes. Then you do the physical examination, including the palpation of the radial artery. Radial pulse, you have to, because there are certain tests like Addison test, military breast test, costocervical, let me see, what is this called? Costocervical test. Okay, there are a couple of tests, so they are not very specific and sensitivity is less, around 70-75%, which is not acceptable, but it can act as an adjunct with the other findings in order to do the diagnosis. So now, causes of these three structures compression. Let me show you that if this is the it's a neck and the scalene muscles are coming like this. And this is one group of scalene muscle, one, and there is another scalene muscles. The nerve will appear, nerve is coming between the two okay, so these are the nerves are coming in between the scalene anterior and scalene medial. And their tendon here are very tight and it does not provide enough space, so anytime this nerve can be compressed. So these are the nerves. Okay, the nerves are coming nerves are coming and the vein, subclavian vein is going subclavian vein, this is subclavian vein, it joins with the external jugular vein and internal jugular vein and then forms the brachiocephalic vein on the right side. And it accompanies also with the artery. Okay, so this is subclavian artery. Okay, so this is subclavian artery. Subclavian artery. So these three structures are very important for the upper extremity, and that can be compressed, that can be injured, that can be impinged by some bony prominence, or between the two muscle gets compressed, or between the two bones. When they are coming in between the clavicle and the first rib, there is a little space, and there is a muscle called subclavius muscle under the clavicle. So during any maneuver in some position, the nerves, the vein and the artery can be compressed. When it is compressed, it will raise the pain or ischemia or venous congestion. If it is compressed, the nerve is compressed between the two scalene muscles, that would be too much pain. Unless surgery, it cannot be released. So nerve will be released from the pressure by the surgery. And vein and artery, when it is compressed, it needs surgery. Okay, so now what are the causes of this thoracic outlet syndrome? It says trauma, repetitive injury, even pregnancy, and when there is a extra ribs and compression by the scalene anterior and scalene medial muscles, and also compression by the clavicle and the first rib. At that time you will see this. So now there are couple of tests. The test can elicit the symptom, and when it is positive, so they can identify that it could be, diagnosis could be this.